Dr. Marjan Assefi said, "Have you ever paused and pondered about the ethical dilemmas that healthcare professionals face every day?" Today, we're delving into the intricate world of healthcare ethics, a world where right and wrong aren't always black and white. Let's begin with the case of Dax Cowart, a Texas man who was severely burned in a propane gas explosion in 1973. Despite his repeated requests to be allowed to die, doctors continued with painful treatments to save his life. Dr. Assefi added, "This case raises the ethical issue of patient autonomy, the right of patients to make decisions about their own health care. Should a patient's desire to refuse treatment be respected, even if it means their death?" Now, consider the case of Henrietta Lacks, a woman whose cells were used without her knowledge or consent to develop the HeLa cell line, which has been instrumental in numerous medical breakthroughs. This case brings forth the issue of informed consent and the right to privacy. Should patients' cells or tissues be used for research without their explicit permission? We then move on to the case of Jesse Gelsinger, an 18-year-old who died during a gene therapy trial in 1999. His death brought to attention the ethical concerns around clinical trials, including risk assessment, informed consent, and the conflict of interest in research. Next, think about the case of baby Kay, born in 1992 with a severe birth defect and kept alive against the advice of doctors because of her mother's insistence. This case highlights the ethical dilemma of futility in treatment. When is it appropriate to discontinue treatment when it is deemed futile? Lastly, remember the case of Terry Schiavo, a woman in a persistent vegetative state whose family battled in court over her right to die. This case underscores the ethical issues surrounding end-of-life decisions and the role of surrogate decision-makers. In this brief exploration, we've touched upon 5 major ethical issues in healthcare: patient autonomy, informed consent, clinical trials, futility in treatment, and end-of-life decisions. Each case study provides a glimpse into the challenging decisions healthcare professionals must make, where the line between ethical and unethical can often blur. In summary, healthcare ethics is a complex terrain that requires careful navigation. The healthcare professionals are constantly tasked with making decisions that can profoundly impact the lives of their patients, often in situations where the right choice is not clear-cut. The cases of Dax Cowart, Henrietta Lacks, Jesse Gelsinger, baby Kay, and Terry Schiavo each highlight different ethical issues that these professionals face, reminding us of the importance of ethical considerations in healthcare. Ethics in healthcare is not just about making the right decision, but about balancing the rights of patients, the intent of medical interventions, the outcomes of these interventions, and the broader societal implications. It's a conversation that never ends, and one that we must continue to have to ensure the best possible outcomes for all involved. After all, at the heart of healthcare ethics lies the fundamental principle of doing no harm while doing the best good